I am thrilled today to have as a special guest Dr. Nicky Keay. I first heard her lecture at IADM's conference, International Association of Dance Medicine and Science. She gave a lecture on hormones and about different problems that especially dancers are confronted with. And I was blown away by the information that she presented. And I had wished that I had had this information as a young dancer so that I could have made better, more well-informed choices about my health and my well-being. Dr. Nicky Keay is an internationally recognized physician, researcher, dancer, and author. She is an honorary clinical lecturer in the Division of Medicine, University College London, a member of the Royal College of Physicians in London, and a member of the British Menopause Society. Dr. Keay studied medicine at Cambridge University and was a research fellow at St. Thomas Hospital, London. Her background in dance includes completing every grade at the Royal Academy of Dance in London. She has treated both professional dancers and professional athletes to help them attain optimal performance in their competition and in life. Dr. Keay specializes in endocrinology, which is a study of hormones, and is the author of Hormones, Health, and Human Potential, a guide to understanding your hormones to optimize your health and performance. This is a copy. I would highly recommend it if you want to take a deep dive into knowing more about how hormones work in your body through different stages of life. I'll have a link to this on my website, physiodancer.com, and it's available on Amazon UK. So Dr. Keay, thank you so much for joining me today. And I would like to start off for asking you just about your background. At some point, you must have thought about becoming a professional dancer yourself, and you chose medicine. What made
Yeah, you spotted that. By the way, first of all, say thank you for inviting me on, and I'm always delighted and very excited to talk not only about dance and hormones, my two passions. You see, which kind of is going to answer your question now. So I'd always done dancing, ballet in particular, from a very young age. Actually, my grandmother used to be a very good level dancer. She was invited to join Nanette de Valois' company.
Wow.
Anyway, so I was always dancing, really super enjoyed it. And yes, I did consider, do I want to go into training with a view to becoming a professional dancer? And I had to be honest with myself. Although I'm good, I passed all the RAD exams and their executant exams right up to advanced, and I was doing amateur shows. I was a decent level, but I had to be realistic, and that actually I wasn't going to be Margot Fonteyn or Darcy Bussell. And actually, I realized that I could probably give back even more to the dance world by actually being a doctor. And also, I was, of course, interested in the body, as one is if you're a dancer anyway. And also, I was just intrigued by what, we go into class, and practice and train. Of course, we enjoy it, but we're doing this also because we want to improve, of course. But then I was just curious. And it's like, well, what drives those adaptations to our dance? We go in, we do the classes, and then next week, hopefully, we're a bit better, But what is happening inside our bodies to help us to achieve that? And that was my quest, because if I could find out that, not only would it help me, but it would help other dancers as well. And so actually, by the way, to give a very short answer if you're wondering what the answer to that question might be, it is indeed your hormones. Your hormones are the key to your health and your performance, hence the title of my book. So that's my story. I absolutely did consider trying to become a professional dancer, but I realized actually I could sort of give back more and by being a doctor and understanding all that nitty-gritty on the medical side and the hormone side. And now I'm delighted I have come back to where I wanted to be. Sort of in the first place. Now I'm here speaking to you, combining both of these passions. As you say, I still dance myself. I'm still doing 4 classes a week, correct?
Yes. And that is awesome. That is really awesome. And that's why I try to tell people, it's like, even if you're not going to do this professionally, you can do it for yourself. You don't have to give up. I have seen dancers in wheelchairs in New York City taking class and still expressing themselves and being a part of the community. So
absolutely. And in my class, which I've been going to for ages. I found an excellent teacher. And I have to say, we're all a decent level. You know, we do a full class, including a dear friend who's in her 70s.
Wow.
And I tell you what, okay, she can't lift her legs that high and she can't jump high, but she does the whole class. She does all the enchaînements, everything.
Yes.
But what she has above all of us, she has the top mark for expression.
Yeah.
She's like my grandmother. She uses her expression. She loves the music. And, you know, that is that enjoyment. So absolutely, of course, you know, if you're a professional, of course, yeah, that is your profession. That is your job. But ultimately, you know, whatever level you are dancing at, why are you doing it? Because of that joy of dance, and also that interaction with others who are also enjoying it and listening to the music. There's so much more to dance than just, you know, the physicality of it. So,
yes.
Yeah, I 100% agree with you there.
Yes. All right. So on to the nitty-gritty questions. One of the things that came up a lot in my career is when a dancer's period becomes irregular. And by the way, even if someone watching this is not a dancer, this is a discussion that is for all women, not just dancers. But since my website is dedicated to dancers, I'm going to keep referring. If a dancer loses some weight and the periods become irregular, a lot of friends will say, hey, just go to your doctor and get on the pill. So that's oral contraception. Get on the pill, your periods will normalize. And I know dancers that have done that, and they get a period every month and they're like, okay, no problem, done. And they go on with their life. What's the problem with that?
Yeah, well, it's like it's a sticking plaster, isn't it? Because just to clarify a few things, to go back on what you said, that having a regular menstrual cycle as a woman, i.e. regular periods, that is entirely normal, healthy physiology. And as I say to all the people I work with, dancers and athletes, and women in general, actually having a period, you know, every month or so, that's the barometer of your internal healthy hormones. That's your free monthly medical check. So if that falters and it becomes irregular or stops and you're not pregnant, then obviously your body is desperately trying to tell you something, that something isn't quite right inside with your hormones, and that's a reflection of that. So if I tell you that, then now think about it. It makes no sense to just stick a plaster on that warning sign from your body and take the contraceptive pill. And by the way, the contraceptive pill, just to be absolutely clear, it does not regulate periods. It stops your periods. So the clue's in the name, contraceptive pill. So it's a very effective contraception. Why is that? Because it suppresses all your the production of all your internal female hormones. It says to the body, it says to the ovaries, look, take a break. Don't worry, you know. And so you're shutting down precisely what your body is trying to alert you to, right? And so you're none the wiser, and you haven't actually got to the underlying reason for why your body was trying to give you this SOS. But it makes everybody feel better. I know why, because like you said, you go to the doctor feels, oh, I've done something, I've written a prescription, the person's gone off happy. Psychologically, the dancer is like, oh, I'm having this regular bleed, it must be okay. But that is not a period. That's what we call a withdrawal bleed. That's induced by the artificial hormones in the contraceptive pill. So the next question I often get asked is like, hold on a minute. If I look at the contents of what's in this contraceptive pill, it's definitely got the words relating to female hormones, i.e. estrogen and progesterone, or something that looks like that. But that's the point, something that looks like that, right? Mm-hmm. So we know what a real arabesque is, right? It's right behind the head. Yeah, okay. It's right behind. Yeah. We know what those funny arabesques are that sort of stick out the side, right? It kind of looks like an arabesque, but it's not really, is it? It's not the real thing, you know? And that's exactly the same with the contraceptive pill. You know, like the true arabesque, exactly aligned, everything, that is your own hormones. Those are your periods, regular periods. But the arabesque that is a little bit off skew, but is a good disguise, that's what the contraceptive pill is. And that is the problem, because everyone thinks it looks similar, so it's kind of the same. But as dancers, we know precision is key, is it not? And so actually, that's why it's a problem.
Yeah, I was going to ask, what are the health risks of you have an irregular period, someone puts you on the pill and you're having a bleed every month.
Yes.
What are the health risks of doing that?
Well, the main thing is because now your own production of hormones was faltering anyway, because that's why your periods are becoming irregular or even stop. But now you suppress them entirely. So really, your question is, why are your own hormones so important? I think. Why is estrogen and progesterone that your ovaries produce? Why is that liquid gold? And the reason is, for dancers especially, these hormones are crucial to many aspects of your health, but some key ones which are very important for dancers: bone strength, bone health. No one wants a fracture or a stress fracture, do they? Also, your soft tissues, so your tendons, your muscles, your ligaments. If these hormones are low, which they will be on the pill, you're more prone to injury. And so that is really the risks in terms of your health for your musculoskeletal system, as we say, the bones and the soft tissues. Also, by the way, your cardiovascular health. We know that not having enough of your own hormones can make a bit of a mess of your cholesterol. People are probably holding cholesterol, so that's not ideal either. And also your mood. These hormones, your own hormones, are very important for your mood, right? How you feel. And so actually taking artificial hormones, which aren't quite the real thing, not the real arabesque, that can actually affect your mood. And we know that one of the side effects of taking the pill, apart from all the physical things that I've mentioned, potentially weaker bones, etc., also it can really affect your mood. And I have a lot of people who say, actually, my mood I just feel really down if I'm on the pill. So listen, I don't want people to get the wrong impression here. I'm not saying that women should not take hormonal contraception. I'm not saying that. I'm saying every woman should choose.
Yeah, that was my next question. In what scenario? Yeah, I was going to ask, in what scenario would it be safe for a woman to be on oral contraception?
So she's made that choice. She's having regular periods.
Okay.
All right. So we know there's not a problem there, but she wants contraception. Mm-hmm. And she's looked at the various options. She's weighed them up. She's barrier methods, right? Okay. So copper coils, condoms. She's looked at progesterone only, like what we call the mini pill, maybe. She's looked at the combined pill, which is the one we're talking about. And she knows all the pros and cons of all those things. And she makes her choice. I want the combined one. And she hasn't got a history of migraines, because if you've got migraines already and you take that, could be not, make it worse. So that's safe. If you've made that informed decision, you have regular periods, and you've made that choice that that's the one that suits you, absolutely. And in medical terms, it's actually, we use it for some conditions where it's helpful to suppress the hormones, like endometriosis, people may have heard of, where you have really painful periods because there's lots of inflammation in the uterus. Yes. So sometimes we intentionally suppress the hormones. Rarely, but sometimes. So there are good medical reasons, and if you make an informed choice, absolutely. But it's not a good choice. In fact, it's advised against. Certainly in the UK, I got them to change the guidelines. We call them the NICE guidelines, the National Institute of Clinical Excellence. But also, by the way, the American Endocrine Society also has written a consensus statement saying this: if a woman's periods become irregular or they stop and she's not pregnant, then please don't give the pill for the reasons I've said. It's like a masking agent. We don't really know what's going on. But unfortunately, that still sometimes hasn't filtered through to everybody and to all the doctors out there. So some of the ones that are sort of a little bit more old school, or maybe not up to speed with it, or not so familiar working with dancers, this is why it can still be offered as the solution, which definitely is not.
Yeah, and just to ask you a little bit more about the problems with mood and people becoming a little bit more depressed. Yeah, at a bunch of the Adams conferences, I have been very surprised to hear about studies that show a vast, like more than 50% of dancers in professional companies, both in Europe and in the US, suffer from depression. Yeah. And that to me was kind of mind-blowing. And do you think there's any link between contraception use, like oral contraceptives, and using them for the wrong reasons and having high levels of depression in a company?
It could be, obviously, without looking at the data. Yeah. I mean, it's going to be multifactorial, obviously. So without seeing the data, but I suspect there could be some dancers where that does apply. But of course, there could be other reasons why they're depressed. Maybe they're not having enough recovery. Maybe they're not fueling enough. They've got relative energy deficiency. Maybe, there's lots of reasons for being depressed and in low mood. But so there's a whole range of things, but certainly a subsection could well be this. Without looking at the data, I can't say definitively, but certainly
I thought I would just ask.
We need to know, but it's a very good point.
Yeah.
And whoever collected that data,
it would be a good study.
Break it down. Exactly, good study. Yeah. The data. Let's break it down. Let's see what the factors are.
Yeah. So I also wanted to ask about dancers that have amenorrhea. And for those of you that don't know what that is, it's when you lose your periods altogether. I know for a lot of dancers, like, oh, good, I don't have to worry about that. And, when I quit my dancing and my career is over, then my periods will resume and I can have a family and everything will be well. What's the problem with that?
By the way, I was one of those dancers. So I kind of, I kind of know, I kind of understand the mentality. When you're younger, you're not thinking about family and babies, are you really? Are you just thinking about dancing and the here and now? So actually, you might think, well, actually, it's quite convenient and I'm not that bothered. But, and I hate to admit this, as I said, it happened to me, but that's because I didn't realize. Since then, I've realized what that means exactly. So, your period stopping, so amenorrhea, for the reason we're talking about. So in other words, for the particular reason that you've got an imbalance in your training load, your energy requirements, and the food you're taking in. So there's a mismatch. Either because you're doing so much training, you simply just aren't able to get enough food in, or you haven't factored that in, or what often the other situation is where you're intentionally reducing what you're eating because you think that will help confer a performance advantage. You'll look slimmer, blah, 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 whatever it might be. But however you end up there, if you haven't got enough energy, then the body will try and economize and save energy, go into eco mode, and it will switch off your periods if you're a woman, you see. So if that's the reason that you've got amenorrhea, that is not good for the reasons we've discussed, because these hormones are gold dust for your health and performance. So you will be at immediate risk, well, certainly within a year or less even, right then there, of getting bone stress injuries, more injuries, etc., all the things we've discussed, sort of thing. But in terms of the answer to your question, okay, fine, it's a bit risky at the time, but the counter argument is like, okay, you take the risk, say, and then you think, oh, well, when I don't dance so much and my periods come back, everything will be fine and reversed. I mean, for me personally, I was lucky. I did go on to have 2 children, so that's great from that point of view. But concerningly, in the study I did of retired dancers, so the ones in this situation whose periods had stopped while they were actively during their career, but then they had resumed their periods and they hadn't yet reached menopause when periods definitely stopped. Nevertheless, there was a bad effect on their bone health. When I looked at the bone health, it was much lower than you would expect for their age. So they probably didn't catch up. So my warning to you, again, also speaking from personal experience, is, we're not sure if all of it is reversible in that sense. Some bits of it might be. Maybe you can, I hope, if you wish to have children, fine. But actually, the bones may be, especially if your periods are stopped when you're young, exactly when your bones are really increasing and reaching what we call the peak bone mass in your early 20s. If you've missed the boat then you can see you're already lower than you would be expected. And so now your periods stop, it's going to go even lower. So, unfortunately, even if your periods do resume later on in your 30s, 40s, you kind of might have missed the boat, you see. So, not something I would recommend, basically.
Yeah. Also, I heard about the immune system being depressed.
Yep.
And so, I know that when I had lost my periods, I became very susceptible to getting sick. I was sick all the time and missed performances because of it. So,
absolutely. Infection and also digestion issues. Because these hormones, these brilliant hormones that I love so much and telling you about, they are important for the bone health, the cardiovascular health, our mood, also interestingly gut health. So again, lots of dancers I find whose periods have stopped, actually the thing they come saying to me is they've got real digestion issues, they're bloated, etc., etc. And that can also be, a sort of an adverse effect of not having periods. So I think what we're trying to say here, isn't it, that periods are great, not the period itself, because the period is simply an indicator. It's like an indicator that all the hormones inside are hopefully doing their thing and you're healthy inside. So actually, cherish that and be happy. And, okay, for the inconvenience, one has to, sort it out. But we're dancers, dancers are organized and can sort things out. That's fine. So actually you can sort that out. But for your overall health and long-term health and your performance, like you said, if you're going to be getting ill and not be able to perform, then that's not going to be helpful at all. So that's what we're trying to say, I think, isn't it? That periods are great.
As a physical therapist, I had to do a lot of different studies in areas. And in college, we had to pick a subject out of a hat and do a report on it. And I chose osteoporosis. And I was really bummed because I thought little old ladies and dilapidated bones. And when in the old days, I had to go to a local osteopathic college to do my research, and they had microfiche. And I plugged in osteoporosis, and instead of little old ladies, is osteoporosis in dancers, osteoporosis in stress dancer, and osteoporosis in premenopause. It was across the board. I thought, okay, I typed in something wrong. Something must be amiss here. But I was shocked, being a dancer myself, that all of this data was there about dancers suffering from fractures and had the bone health of 70-year-old women.
Right,
their
exactly.
Teens. It was frightening.
Yes, exactly. You make a really, really important point. I mean, you say the word osteoporosis, and you kind of immediately think of old people, but actually, it is a current problem that I see a lot, and I'm doing. I do a lot of research with dancers in this field, showing the adverse effects on bone health, and that actually is a very good motivator to show. Everyone's heard of a stress fracture. And everyone sadly has probably seen somebody going around with one of those air cast boots and things like that. So, if there's a way you can hopefully reduce that risk, wouldn't you take it?
Yeah.
Right? Yeah. So, and it's something you can do. It's something under your control to try and make sure your periods are regular by having a real hard critical look, sometimes an honest look at your nutritional patterns and your training load and your recovery. Have you got that good balance, or are you not eating enough, frankly? Especially the carbohydrates always come in for a bad press, don't they? Just be honest and critical. Well, not critical, just be honest with yourself and look at it, because it's something that you can take control of, and it's really satisfying to do that.
You've been talking about the balance of certain things, and you've talked about fueling and about rest. You touched on that. Could you just give us kind of a screenshot of the important things that dancers need to balance in order to maintain their periods and maintain the energy level?
Well, it's actually those three things. I like things when they're simple, so that's why I kind of figured it out, right? It's the training load. I mean, I know you have to, of course, you haven't got an option. If you've got to do class, you've got to do rehearsals, but again, are you doing extra training that you don't actually need to? Because I find a lot of dancers, they feel obliged. They've also got to do extra practice or extra stuff. You know what I mean? And actually, maybe if you've got a really full schedule already, maybe that's too much training. The body can only take so much stress. So look at your training load and therefore match that with sufficient recovery. Because that's when you're actually going to get fitter. You don't get fitter and better when you're actually in the studio. You get fitter when you're asleep. So are you getting enough sleep? Are you having at least one full rest day?
I'm sorry, is recovery sleep only, or is it sleep and rest?
Good point. We should absolutely, we should divide it into two. Recovery includes sleep for sure. Yeah. But also rest, like having a rest day, whatever day of the week that might be. Typically it would be a Sunday, wouldn't it? I know you might feel that guilt or compulsion or whatever word you want. I have to do a class. I can't have a day of the week when I'm not doing a class or not doing something. Yes, you can, and you should. So you're right. We should, quite right. Thank you for highlighting that. We should break down recovery into recovery during the day, like have a rest day per week, and also sleep is the absolutely the key when it comes to recovery. So we've got training, we've got recovery, which includes the rest and the sleep. And then the third important component you mentioned is the nutrition. Absolutely. So again, have a look and a review of how your eating pattern, and my grandmother always used to say, breakfast is a really important meal. Don't skimp it. She was absolutely right. At the time, I used to think, oh, that's an old wild tale. But then we have so much research now saying that actually, yes, you need to, it's not about a massive meal in the evening and hard eating anything in the day. It's about spreading it out. It makes common sense. The body, the hormones want to see, more to the point, consistent intake, breakfast, lunch, dinner, and snacks as appropriate. Obviously, if you're going from one class to the other, you should be eating a banana or a cereal bar or something to keep you going, to keep the energy levels up. So, but if you think about these things, these three things, these are things that you can do under your control, and you can, work out the right balance. Yeah. The other sort of fourth thing, I suppose we should say, is stress management, which is a little bit of a tricky one. I mean, by definition, a dancer's life is stressful, very stressful, right? But it's how are you going to deal with that? Mm-hmm. What works for you? Again, it's going to be individual. Yeah. For me, it is actually just listening to some music and just like that. For some people, it's reading a book. What is it that works for you? Is it meditation? Is it mindfulness? Whatever it is, we all need the brain to unwind.
And the many dance conferences that I've gone to, and even listening to other dancers themselves that have been successful, I think also having perspective and things, interests outside of dance. I like to, go for walks in the park. I like to sit on the beach. I have this group of friends outside of dance, like to have that social network, especially, very, very important.
Yeah. And by the way, just on health is actually defined as about both physical, mental, and social health. So actually, that's a really important point. I'm glad you brought that up. I know dancers are so much intense and there's a lot of time, which, your dancers can be friends as well, don't get me wrong. But like you say, actually,
they're also your competition.
But having your interests outside and some other friends who don't know anything about dancing and just want to go and watch a film or go to the beach, that's actually quite healthy as well.
Yeah. So I'm wondering if you could touch on REDS. I think some people might have heard the term REDS and they think, oh, this is just for athletes. Can you expand on like what that is and why it's bad, and signs and how we can work against getting REDS?
Yeah. So as you say, and that's a really super important point. It's REDS stands for relative energy deficiency in sport. But interestingly, there's an updated IOC consensus statement on this, and they've made the S a small case. Mm-hmm. Now, you might think, well, that seems a very small detail, but actually small details are important in this case. So I'm talking a lot about relative energy deficiency, full stop, in whoever you are. You can be an athlete, you can be a dancer, you could be like just an exerciser, just doing a lot of exercise, but you're not competing or performing in shows. So anybody that's doing exercise, especially I would say exercise that is has an aesthetic demand, which of course dancing does, then that could be a group of people that are going to be at risk of developing relative energy deficiency. Okay, so what does that mean exactly, relative energy deficiency? So it means energy deficiency means not enough energy, but relative is the important word here also because it's relative. If you sit at a desk all day and you eat a certain amount of food, and that's fine for your requirements, but if you're a dancer and you eat the same amount of food, but you're dancing and doing lots of exercise, that's relatively speaking not going to be enough energy for you individually. And I think this is where lots of dancers get confused. Unfortunately, at the other end of the scale, we've got an obesity epidemic. Yes. And so actually those people probably could do with an energy deficit, right? But that's because they're probably not doing so much and they probably are eating above their requirements. But dancers generally are going to be the opposite end. They're doing so much, you need a lot of energy. So that's what REDS is. If you're not taking on enough energy, fueling sufficiently for your dance requirements, and to keep healthy, then there will be adverse consequences in terms of, for women, for female dancers, your periods will switch off. The body quite sensibly will look for ways to save energy. So switching off your periods is one way. Also, you mentioned the immune system. You haven't got enough energy for digestion. Everything in your body will just go power down. Like when your phone runs out of charge, it just powers down. All the non-essential apps don't work anymore, you see?
And so your performance decreases as well, because your muscles do not have what
yeah, that's the crucial thing. So these are health things, but I have a lot of dancers say, okay, yeah, we understand all that, but I just want to dance. It's like, precisely. And so you will still be able to dance, but you will be
but I don't have the energy to get through this difficult variation.
And yeah, exactly. You'll really be out of path, and you'll be annoyed with yourself, I can tell you, because you feel you are lacking that, and you won't be able to finish off the line and hit that finishing position or pull off your triple pirouettes, whatever it is. You just lose the edge. So you still will be able to dance, of course, but just not as well as you are capable of. And that's really sad. If you've done all this training, all this preparation, and then you can't perform to your best, that's not a good situation to be.
The gory videos that I've seen of injuries happening on stage, you can just see someone's leg, usually coming down from a jump, crumple underneath them.
Yeah.
And you could just see muscle failure, just like there's nothing there. And I think it speaks to that exactly. And that gets people's attention.
Well, quite exactly, the scary negative injury thing. So, I mean, to make clear that if, no one's perfect, that's the other thing. Sometimes you have the best intention that you are going to have your lunch at 1 o'clock, but then something happens, you get a call, in dance as well, something happens and it's a bit late. Listen, few little slip ups like that, it's okay, the body, you'll cope. But if, especially intentionally, day after day, month, week after week, etc., you are intentionally restricting, or you're always in deficit, then that's when the adverse effects of the relative energy deficiency syndrome will start to come into effect. And the performance one, that's definitely always the one that hits home. That's also going to, really drop off, and that's really sad.
So we have a few minutes left. So I'd like to also talk about the older dance population and something to look forward to for some of you about menopause. Here in the US, I would be very confident to make a broad generalization. Most women have heard that hormone replacement therapy is bad. You shouldn't take estrogen and progesterone when you stop having your periods because you're going to get cancer. This is the general consensus, and I would love for you to speak to that.
Well, that's not true. There's a simple answer. So what is menopause? So menopause is when your ovaries retire. Okay, so they stop producing those hormones. It's not an illness, it's not a disease, it's a natural process. But because we're living longer, we're probably going to be spending at least a third of our life in menopause, right? And so if you want to be still dancing like my friend I mentioned who's in her 70s, then actually, HRT will give you that possibility. So specifically, HRT, hormone replacement therapy, as you said, it will contain both estrogen and progesterone. If you haven't had a hysterectomy, you must always have both components. And it's true, we have to say, there is a slight increased risk in breast cancer of an extra 4 cases per 1,000 women aged 50 to 59. This is exactly the same as taking the oral contraceptive pill. And by the way, if you're doing 2.5 hours of exercise or more per week, it decreases the risk of breast cancer by 7 cases. Okay? So if you do your maths, you're still better off. And by the way, if you don't take HRT, but you don't do exercise, you are overweight, you are smoking, you are drinking, a fair bit of alcohol, whopping extra increase in breast cancer cases by 24. So it's all relative. If you are doing your dancing and you're being as healthy as you can with your nutrition, then actually HRT will actually help your health, because it will reduce the risk of getting osteoporosis and reduce the risk of cardiovascular disease. Just to say, the main cause of death in postmenopausal women, what do you think it is? If you go, well, they did this survey, they went around and asked women, and most of them did say breast cancer, but it's not. The main cause of death is cardiovascular disease.
Yes.
So estrogen HRT rather, should I say, is helpful for reducing that risk. So, but listen, it's a sort of similar discussion to the contraceptive pill. You know, I'm not saying, and I'm not being bossy and saying all women must take HRT. It's entirely your choice. But again, it's like we said, to make an informed choice. Please don't listen to scarce stories. Look at the facts. Make the decision that's right for you. Okay, and
are there any like broad contraindications to getting on hormone replacement therapy, like diabetes, high blood pressure, things like that?
The only absolute contraindication is if you personally have had breast cancer. One of my dear friends in my ballet class has sadly, dealing with that. And HRT is off the card for her, because if you already have breast cancer and it's estrogen positive, then obviously it's clearly not a good idea to take HRT. But actually, all the other conditions you mentioned, actually HRT would probably help, because it will help reduce the risk of the, consequences of the high blood pressure, cardiovascular disease. Of course, coupled with lifestyle, the nutrition and the exercise must always be the fundamental starting point. So I think if you're concerned about HRT and you've heard these stories and that's your concern, then please go and have another look at it. In the UK, we have the British Menopause Society website. And of course,
we have something similar here. Yes.
Yeah. And it's similar there. And also in my book, I discuss all the facts and I've got all the references if people want to look, well, at anything we've discussed, but including the HRT story. Where does this story of misinformation start from and what are the real facts? So please, I encourage all women, as in anything, inform yourself. There is the reliable information there, and make sure you're making an informed decision that's right for you, not what's somebody else that you've heard from somebody else.
Yes. And what do you feel about the non-hormonal alternatives to hormone replacement therapy, like women that say, I don't want to take hormones, but I'm going to take this herbal pill?
Sure. I mean, the thing is that as the British Menopause Society say, that there's no clear evidence that these work or are helpful. But on the other hand, for example, like my dear friend who can't take HRT, actually, why not? Of course. And also, provided they won't do any harm, then that's fine. But just make sure it's really good quality, because unlike medications, they won't necessarily be licensed, regulated under either drug rules or like food rules. So, make sure it's good quality. And if you feel it's helpful for you, then that's fine. But be aware it is a bit of a mixed bag. If we're saying, is there absolute proof? It's like, well, not really. It's uncertain whether it's helpful or not. But if it's not harmful, on the other hand, then,
Okay. In finishing up this discussion, I don't want to neglect the men in the audience. And I just want to ask you, do men have hormone problems? Is this just a female thing that men just don't even need to be, worried about?
Mm-hmm. Well, newsflash, important newsflash. Men have hormones too. By the way, because women, we have testosterone at lower levels than men, it's true. By the way, men have many hormones, including estradiol, by the way, estrogen, what's so-called thought to be the female hormone, because, by the way, estradiol is queen when it comes to bone health. In men as well, they have to convert some of their testosterone to estrogen for their bones. So anyway, but all the other hormone systems, the thyroid hormones, blood glucose control, all these other these hormones, they're the same in men and women. Okay. So absolutely, therefore, men and hormones are just as important for all the reasons we've discussed in women. They keep us healthy. They drive the positive adaptations to our exercise training. So equally, men can also be therefore affected by, issues with imbalances in behaviors and therefore hormone problems. So, for example, REDS that we discussed earlier, relative energy deficiency, can happen just in the same way in men as it does in women. It's true we probably see less men affected, but that's not to say that some aren't. There isn't such a complex choreography of the hormones of the menstrual cycle that women have. There isn't this sort of equivalent in men. There is a fluctuation of testosterone during the day in men, but otherwise we don't have that beautiful choreography in women that we see in women. But and the other point is, I often get asked, do men have the equivalent of the menopause, andropause? And it's true that men's testosterone does decline a little bit from the age of 50, but a little bit is the crucial word I'm stressing here. Whereas in women, because the ovaries entirely retire the female hormones definitely take a big nose drop, in terms of their levels. And women, of course, can't have children after that age, whereas men, as we know, they can, continue to sire children, and their testosterone level, although a little bit lower, isn't much. So the bottom line is, yes, there are a lot of similarities with men and women in terms of their hormones. The proportions are slightly different if we're talking about the reproductive axis, but there is a big difference in because of the menstrual cycle is very individual to women, and the changes of the cycle and menopause, whereas men, there isn't that equivalent.
So the men that have come to seek your professional medical advice for their sport, what type of symptoms do they have? Say a 20-year-old professional dancer, great career, very strong, technically proficient. What type of complaints would they come to you with if they have some type of problem with their hormone?
Well, the main type of male dancer I see has got REDS, or an element of it, relative energy deficiency, including the younger ones in training and the ones, in their 20s, like you say. And I mean, it will be very similar, the men and women. They will feel tired. Are they complaining
of poor performance, like they don't have energy, or what type of?
Precisely. They will so what will be similar in the men and the women, male and female dancers with REDS, which is what I commonly see. They will say tiredness, difficulty sleeping, low mood, maybe just lacking energy, performance, all those things that are common. But of course, the difference is, for female dancers, it's kind of easy. I just say, what's happened to your periods? And that's the barometer of their healthy hormones. Whereas the men, there won't be the obvious thing. I'm a medical doctor, so I can ask men, how many morning erections do you get? Right? Not probably is the first question I ask them when they walk through the door, but I can ask them that, and about libido, although that's a little bit tricky. But they're very similar, apart from that crucial difference about the menstrual cycle or the effects of low testosterone. But actually, that is the main reason I'm seeing both male and female dancers, because they haven't got that right balance of the things that we discussed, the training, the recoveries, and the nutrition.
Okay. And if someone has thinks they have a problem with their hormones, or they think they might have REDS, or a young woman has problems with her periods, I think in the United States, most people don't know who the specialist is that would see them. In the US, most of the time people see a general practitioner, which is great, but this is a very specialized area. Endocrinologists in the United States are few and far between. I know in my town of Santa Fe, there's one.
Really? Just oh my goodness.
Yeah. Wow. So the OB-GYN, obstetrics and gynecology specialist would be the person that, as a physical therapist, I would try to route people to for advice. I don't know for men if it would be an endocrinologist is who they would have to see, like who the specialist would be in that area.
I think it probably would, because we have a similar sort of situation here, because sports doctors are often trained specifically in injuries, you see, and not so much in this hormone area. And equally, like straight up endocrinologists, which is where I started myself. You have to know the basic, tools of the trade sort of thing. Actually might be not so familiar with the sport and dance side of things. So it is tricky, I accept. But also the other thing is, it also really depends on the level of interest, your primary care doctors, or the GPs, as we call them here in the UK. I know some of them who are very interested in sport and dance, and actually will have a very good knowledge. And actually, I give, talks to these GPs with a special interest, and they can be really good. But unfortunately, equally, can be those that aren't so interested and motivated to find out the latest. So I think it's not, I can't give a general rule, always go and see this doctor, that doctor, whatever. It's kind of a case of finding out sort of as best you can what doctor, it doesn't matter what their speciality is, interested in this. Because actually some of the sports doctors are interested in what we're talking about, and not just so focused on the injury. You see what I mean? So it is a little bit of you have to sort of find out.
Yeah. And again, in the US, sports doctors are few and far between.
So then maybe that's
unless
not
you're
a good
in LA
suggestion.
or New York.
Exactly. So I think it's just asking around in your own networks, like you mentioned.
Yeah.
And also just to say that I do advisory appointments, virtual advisory appointments. So obviously I can't take the role of your own local doctor. Obviously I can't do that, but I can at least advise. I can talk you through what's going on, and you can show me your blood results, and I can say, well, look, this is or isn't RED, and I can give some suggestions and signposting. So if people are really struggling to find somebody they can relate to.
And so that's my next question. How do they find you?
So I have a website, Nicky Keay Fitness. My spelling of my surname is Keay, Nicky Keay Fitness. That's my website, where I've got all my information about the advisory appointments I discussed, presentations that I do, books that I write, all those sorts of things. So you can find me on my website. I am also on social media. The handle is at Dr. Nicky Keay. I mean, I'm not massive on social media, I have to be honest. Occasionally I'll do there, but it's not really my thing.
I am begrudgingly there. But
yeah, exactly. I'm there, but if you want to contact me, and obviously I can't answer individual questions, obviously.
Yes.
So I think probably my website is the best, but social media you can see. And then, of course, my book that you mentioned at the very start. Of course, it's not a personalized thing, but it hopefully will give you extra information and background.
Yes.
And actually, hopefully, if you read that, if it's, you might be able to sort of at least get yourself started or figuring it out, get yourself on the right track anyway, you see.
Yeah. And here's the book again, if you would like to see it. It's on Amazon UK. And, I would just advise, not just dancers, but everyone in general, going on Facebook and saying, hey guys, I have this medical problem, I'm looking for advice, is a super bad idea. Be careful about asking your peers that are not medical professionals for advice. I mean, really, if you have a medical problem, you need to see a medical doctor. I can't stress that enough.
Yeah. Well, and by the way, physiotherapy, I always say, frankly, if you have an injury, go and see a physiotherapist. It kind of, that's what you would do. I mean, of course, you can listen to what others, your friends, are saying, but as we heard about the pill story, it might not always be. It might, obviously, it's going to come from a place of good intention, but they might not have the reliable information like you don't either. So actually, if you really want to know what is reliable and what's fact, what's fiction, what's myth, what's not. Oh, by the way, I'm going to be editing a book talking about myths of menopause. So look out for that. That will be coming next year. So exactly, we'll be doing lots of myth busting. So yes. But please, it's been such a pleasure talking to you, and anybody that wants to find out more,
your time and your expertise. I mean, just really invaluable. I was very impressed by your lecture at Adams, and I am just so thrilled that you agreed to do this little chat with me.
No, my pleasure. Thanks so much.
All right.